Hey everyone, I'm Amanda Johnson Fleming, pediatric nurse practitioner.
And I'm Brittany Schlegel, a registered nurse at the clinic.
And we work together over here at the Nayashin Clinic. We'd like to welcome all of our families into the new 2023-24 school year. This is such an exciting time of year. It can also be a challenging time of year where many of us come back together in small spaces and whether we like it or not, end up sharing those pesky germs that can make us sick.
Follow along for part 1 of our 2-part quick series as we share some tips, tricks, and reminders from the American Academy of Pediatrics and the Centers for Disease Control and Prevention on how to keep our bodies healthy this season. We will also give some guidance on what to do if you're not feeling so great. Prevention. Masks. Everyone is wondering about masks.
Masks are optional at this time. Wearing them can help prevent the spread of illness. Health and Human Services will make an announcement if any changes occur, but at this time, they're not mandatory in our clinics or schools. Our clinic will continue to follow and suggest guidelines provided by the CDC, so stay tuned. What about hand washing?
Very important. Help your children wash their hands for a minimum of 20 seconds with warm, soapy water. 3 really important times that hands should be washed are before food preparation and eating, after using the restroom, and following a school day or outing when returning back into a home before engaging in other activities. What can we do about shoes and backpacks?
Leave those shoes at the door. We don't want to walk those germs right into our homes. And for book bags or backpacks, you can wipe them down when possible to help keep them clean. We know that throughout the day they touch many different surfaces, and those surfaces can be full of germs. Hey Brittany, can I have a sip of your water? Just kidding. Sharing isn't always caring.
Correct. Avoid sharing food and beverages with others because when we do this, we are also very easily sharing, you guessed it, germs. What if I have to sneeze or cough?
That's another great question. Teach each other how to cough into the corner of your elbow and try to contain those germs versus directly into our hands, which then go on to touch other surfaces that other people are touching throughout the day. Is it lunchtime yet? I'm feeling kind of hungry.
Not yet, but that's another great tip. Eat a healthy diet and stay hydrated. This helps give our bodies and brains the energy that we need to get moving and to help us learn throughout the day. Moving, another good tip.
Right. The CDC says that kids ages 6 to 17 years old should be engaging in moderate to vigorous exercise for at least 60 minutes each day. Sounds a little tiring. I probably would get good sleep after that.
Probably. Most kids need between 8 to 10 hours of sleep at night. This is our body's time to rest and reset. Turn those screens off a couple hours before bedtime and give your body time to wind down.
Combining these things helps us keep a healthy and strong immune system. That's just a fancy way to describe our body's own armor that protects us from and fights off different illnesses.
Last but not least, well visits. Let's work together to stay healthy. Call the clinic today to get your child's annual well visit scheduled if you haven't already.
Consider vaccines for COVID and/or influenza. Vaccines are a safe and effective way to protect communities from harmful illnesses and diseases. Talk to your healthcare provider about how getting one or both of these vaccines can protect not only the individual receiving the vaccine, but they can also help protect those around them that may or may not be able to receive the same vaccines. Sounds pretty cool, right?
I think so. So, those were some great tips, but what to do if I or a family member actually gets sick?
If you or a family member actually gets sick, we want to keep in mind that if you have a fever, 100.4 degrees or higher, are experiencing vomiting and/or diarrhea, please stay home. We want you to be able to go 24 hours without any of these symptoms before going back to school, childcare, or work. If it's been 3 or more days of these symptoms occurring, please call the clinic to schedule an appointment to be evaluated by one of our healthcare providers.
If you have COVID-like symptoms such as a fever or chills, cough, shortness of breath, or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion, or runny nose, nausea, or vomiting or diarrhea, contact the clinic to see if it is recommended to get a PCR test done in the clinic or laboratory.
If it's positive, follow recommendations from your healthcare provider on staying home and masking upon return to school or work.
If negative, you could have other viral infections. Take everyday preventative actions to prevent spreading the illnesses to others.
If you're sick, stay hydrated, eat well, eat a well-balanced diet, and rest.
Thanks for tuning in for our back to school health tips. We hope you have a great year.
Keep an eye out for Part 2, Health Tips for Mental Wellness. Thanks, everyone.